frequent reason that people come to see me in the office is they want a vasectomy. A lot of times people know what they're getting into and they understand what a vasectomy is. And I think if people knew what a vasectomy was, more people would come and get them, because to be honest with you, they are a really quick and easy procedure, and it's a lot easier for a man to get a vasectomy than for a woman to get a tubal ligation, because a vasectomy is an outpatient, local anesthesia. Now, tubal ligation is a different story. You have to get surgery, and you have to get general anesthesia and whatnot. Now, general anesthesia is safe by and large, but it has its own risks. And a vasectomy is so easy, quick, and simple that I think it's probably, if a guy had to choose between a vasectomy and a tubal ligation on himself, he'd probably pick a vasectomy. So I guess because that's the case, I would say vasectomy is easier than tubal ligation. But what is a vasectomy? Well, a vasectomy is cutting of the vas. What is the vas? The vas deferens. Well, if you reach into your scrotum and you basically palpate right on top of the testicle, you'll feel there's something going into the testicle. And that thing that's going in the testicle called the spermatic cord. The spermatic cord is not the vas. It's a bunch of stuff, including the vas, but it also has a testicular artery, veins, and the vas, and some lymphatics, and some connective tissue. So the vas happens to be the structure that's the most rubbery and the thickest of all of these other structures I just mentioned. So if you reach into your scrotum and reach right on top of the testicle, you'll feel something going into the testicle from the top, and work your way out. As you work your way out, you will feel something that will feel like a little bit of a rubbery, undercooked spaghetti, and that's the vas. And you can feel it every morning if you want, just to make sure that it's still there, but you don't have to. So if you basically, when you go see the urologist to get a vasectomy, that's the first thing they'll do is they'll feel the vas. Now, some people have scrotums that are very, very thick, and the scrotum skin itself is so thick and the whole scrotum is so bunched up that it's a little bit harder to feel. And some people have scrotums that are very thin and they just hang, and those are the easiest to feel the vas. So what do we do when you do a vasectomy? Well, just like you felt earlier when I was talking to you, I knew how you were feeling the vas and you were bringing it to the side. If you bring the vas all the way to the edge where there's almost like nothing between the vas and the skin, then we do that, and then we bring it to the skin, and then we numb the vas and numb the skin so that way you don't feel anything. And we make a tiny poke right in the skin and get to the vas and basically cut the vas, and then coagulates the inside of the vas. So that way the vas is no longer acting as a channel between the testicle and the rest of the body. And why would that make you sterile? Well, the reason because the vas is actually the tube that hooks up the testicle to the urethra, which basically, is going to be a channel for the ejaculate to come outside of the penis. So basically, the testicles are sitting right there, and they're getting the blood supply, but also coming out of them, there's a vas deferens. And this vas comes up right inside the body, and then comes inside, and then hooks up into the urethra at the verumontanum, and then the sperm can come out for when you're ejaculating. So if you cut the vas and basically burn the inside of it a little bit, it makes a connective tissue barrier that now the sperm no longer can go from the testicle to the inside of the body. And if it cannot do that anymore, then obviously there's going to be no sperm in the ejaculate. So you're thinking to yourself, well, if that happens, then I can't ejaculate anymore. Well, that's not true. Actually, sperm is a tiny, tiny portion of the ejaculate volume. Most of the ejaculate volume is made up of seminal vesicle fluid and prostatic fluid, but mostly seminal vesicle fluid. It's not the sperm. The sperm is a tiny portion of the actual semen, of the actual ejaculate. So as soon as you get a vasectomy, you won't be sterile right away. You still need to use protection because it takes about 3 months or 20 ejaculates for you to get rid of this semen or the sperm that's actually already inside, that is crossed on the other side of the vas from before the surgery. So 3 months later, you get a semen analysis, and then it says you have 0 sperm, then you're good to go. But until then, you are still not considered, sterile. And the procedure takes about 10 to 15 minutes in the office. It's rather painless. There's usually no other side effects than the mild discomfort. You can go to work the next day, or some people even go home. Some people even go to work the same day. So that's pretty much it. And there are small little tweaks that I like to use to make the vasectomy even less painful and to prevent any potential bleeding. I do use magnification because of the small little artery that's right on top of the vas deferens that I peel off, so that way there's almost like no bleeding at all. And I also interpose tissue between the 2 ends of the vas that also makes it more secure. If you have any questions, let us know, but that's basically what a vasectomy is.